topic of research in our group, one of the topics is fecal microbiota transplantation in patients with steroid-refractory or steroid-dependent graft versus host disease. So this is actually a really difficult to treat group because once you're refractory to steroids, the outcome is usually not so good, poor actually, and there's not like a set second choice therapy. And it's been for ages, I can say, that people have been interested in the role of the microbiota in health and disease, amongst others in the health of the gut. And a lot of research is done these days on how the microbiota of the gut, but actually the microbiota of the whole body influences the health of individuals. And we know that the disturbed microbiota is associated with a number of diseases, also, for example, metabolic syndrome, etc. Not only graft versus host disease. Now, a lot of research has been done by the group of Marcel van den Brink at Sloan Kettering and also in Germany by the group of Ernst Holler, who have showed that in patients that are transplanted, the microbiome is damaged. And this, in patients that do develop graft versus host disease, this damage to the microbiota of the gut continues or increases, worsens. And so people have started to search for ways to manipulate the microbiota of the gut. And one way, of course, is to change the whole microbiome of a patient by doing a fecal transplantation. The interesting thing is that while it may sound gross, actually patients are usually pretty excited about the whole thing because fetus obviously is a natural product and they are much less reluctant to undergo such a treatment as at least I would have expected. In any case, so we've been hesitant to start this whole process because, of course, these people are severely immunocompromised and they have a damaged gut, and then you'll give like a microbe bomb. I mean, there is a high risk of translocation of bacteria, and with a very bad immune system, this might, of course, be harmful to patients. But it turns out that actually, as long as donors are screened really well, it seems to be safe, at least so far. At least I am not aware of severe side effects of this treatment, but of course we are in a very early stage, so it's too soon to tell. But it seems that at least a proportion of patients is really responding to this therapy. So patients that did not respond to steroids or that were dependent on steroids, that we could not taper steroids, had normalization of stool, and subsequently we could actually taper and stop all immunosuppressants. So that was really successful. Now, of course, not all patients respond, and roughly in our hands about 2/3 of patients respond, but then in about 1/3 of patients we are able to completely taper and stop immunosuppressant. At our institute in Amsterdam we have treated so far 17 patients with this therapy, and as I said, it's been successful in about 2/3 and really successful in about 1/3 of patients. I know that several places in the world, other institutes are also exploring the possibilities of FMT in this setting. I do think it's important to learn as much as possible from this. So also in centers where people are doing this, I think this should be done in a setting of a trial, so that also side effects and risks are monitored closely, and that we can learn as much as possible from this therapy, both in a positive way, the effect of this therapy, but also in a sense with respect to the dangers and the complications that occur.